that tobacco use harms LGBTQ communities and envisions possible alternatives. My name is Celena Morrison. I use she and her pronouns, and I am the Executive Director of the Philadelphia Mayor's Office of LGBT Affairs. Our office is so appreciative for the work of our partners in producing this event. Uh, those partners are the Philadelphia Department of Public Health, the William Way Community Center, and the Health Promotion Council. For this evening's event, we are joined by a fantastic group of panelists, including Ryan Coffman from the Philadelphia Department of Public Health, Adrian Shanker from the Bradbury-Sullivan LGBTQ Community Center, and Lee Thomas from Philadelphia Black Pride. Tonight's session will focus on the impacts of tobacco use in LGBTQ communities and why it is essential for prides to become or remain tobacco-free. Before we get started, if folks have questions, please put those in the chat and we will address those during the Q&A at the end of the presentations. Also, we ask everyone that is not a panelist to keep your cameras off and to keep yourself muted. So to start us off this evening, I start with a question directed for Ryan. Ryan, I know you've worked in tobacco cessation field for some time now. Can you tell us about your experience working? Well, of course, introduce yourself and tell us a little bit about what you do, and tell us about your experience working with various tobacco-free prides in the greater Philadelphia area.
Great. Hi, everyone. Thank you so much for having us here tonight. Really excited for the event. You're in for a real treat. Lots of really talented and compassionate speakers will be here tonight, as well as I'm sure there'll be some great questions from those that are tuning in. By way of a quick introduction, I'm the Tobacco Policy and Control Program Manager with the Department of Public Health here in Philadelphia. But prior to joining the department, I worked a lot in clinical tobacco treatment. So actually, it's formerly known more as smoking cessation. Now we call more tobacco use disorder treatment. So treating addiction to nicotine. And I think the 2 points I would just briefly share about how I view that work, and I'll go into more later in my presentation, and then to Celena's question about tobacco-free prides, is that I frankly just don't believe in lost causes or hopeless cases when it comes to tobacco use. I think no matter how long or how much someone has used tobacco, no matter how long you've been on that road, you can always take the off-ramp or make the U-turn towards a tobacco-free life. And I'm tremendously supportive of tobacco-free prides because there's a variety of benefits that this confers to LGBT communities, as I'm sure Adrian and Lee will go into in great and compelling depth. But one thing that I think is really important is it's an excellent opportunity to get people to think more about their own tobacco use. And when they experience tobacco-free events, they're more likely to act on their own tobacco use and to seek to become tobacco-free. So I think the issues of tobacco-free prides and promoting tobacco-free lives are intimately intertwined with each other. So I'm so glad to be here and looking forward to tonight's discussion.
Thank you. So I understand you have a presentation for us.
Yeah, and I'll keep it really brief, guys. I just want to hit on a few high points to kind of set up the real important discussion here tonight around tobacco-free pride events. So if you guys can see, I'm going to share my screen with you here. Give me 1 second. Let me know if this is coming through loud and clear and stereo for everybody. Hold on. Can you guys see this okay?
Mm-hmm.
Excellent. So I'll be really brief. As was mentioned, I'm work more on a policy and level with the Department of Public Health, but prior to that, I worked for many years in clinical tobacco treatment in a variety of different settings, and I'm still fortunate enough to be able to see patients half a day a week in South Philly at Health Center 2, which I'm really, really grateful for. So I'm just going to share a few quick points that's both informed by my own experiences in treating nicotine addiction over many years, but also what the evidence really points to and shows us is the way to make becoming tobacco-free easier and more successful. So I'll hit on those very, very briefly, And I wanted to lead off with this simply because, as we mentioned, we know that tobacco-free spaces do a number of things, which our other speakers will go into, but one thing that is very, very clear is it motivates individuals to initiate their recovery from tobacco use. So knowing that the other presentations may stimulate that thinking in folks that are listening in tonight, I wanted to make sure, at least as part of this discussion, were equipped with a few resources to act on both your tobacco use or that of those that you love and you care for as well. So these resources are universal. They're for absolutely anyone in the city of Philadelphia and beyond to initiate that recovery process. So this is a bit of old hat, but important to really reflect on, because I think a lot of times when you talk to folks about tobacco use, if you walk up to someone on the street and say, hey, what's something other than lung cancer that caused by tobacco use? That's a challenging question for a lot of folks, not because folks are not well studied on that issue per se, but because the tobacco industry has gone through great lengths to conceal and contort our understanding about the real harms of the products that they exploit communities with, and that they have targeted in a predatory fashion towards communities that they deem to be vulnerable, such as LGBT communities. So this is just a sampling of the various impacts of tobacco product use. And so as you can see, it really affects every part of our bodies, inside and out. The beauty of this, the flip side of the coin, is that when you become tobacco free, that recovery process begins in as little as 20 minutes after our last tobacco intake. So no matter, again, how much or how long we've used tobacco, when you become tobacco free, the experiences of gains in life and livelihood, length and quality of life, are almost immediate, which is tremendously exciting. Tobacco is the leading killer of Philadelphians. Now, these numbers have shifted a little bit with gun-related homicide and drug overdose due to the opiate epidemic and its impacts in Philadelphia, but tobacco is still the leading killer in the city of Philadelphia. And that includes more deaths than COVID, in fact. So it's important that we never lose sight that tobacco is the single greatest preventable cause of death and disability in our nation, and it inflicts tremendous harm in the city of Philadelphia as well. But not just physical, these are all the other impacts of wellness that are undermined by tobacco product use. And so we think of wellness sometimes in a one-dimensional way, right? We just think if I'm well, it just means I'm not sick. But wellness is really comprised of a number of domains. And I think we could argue this point, on this call, and something we can all generally agree upon is wellness is also your social wellness, emotional, spiritual, occupational, and tobacco product use affects all these areas of wellness. If we just pick financial wellness, for instance, a pack-a-day smoker in the city of Philadelphia will spend almost $4,000 a year on tobacco product use. That leaves little left over for healthcare, education, food, clothing, recreation, and leisure. So by becoming tobacco-free, tobacco control can really be looked at as an anti-poverty initiative, right? That when you consider that tobacco product use is heaviest among low-income populations because they've been targeted most aggressively by the tobacco industry, this contributes to poverty and keeps people in poverty due to the addiction to nicotine caused by the tobacco industry. It may seem a bit tone deaf to talk about tobacco product use at a time when we're experiencing so much in this nation, when it feels like we're in a state of just nationwide upheaval. A point that I would ask folks to leave with tonight from this particular portion is we really view becoming tobacco free as a form of self-care. Just like folks are learning new recipes, taking walks in the autumn foliage, which is beautiful right now. Get out if you're not currently taking a lot of walks outside. It's beautiful right now. It's a wonderful time. Those are forms of self-care. So too is being tobacco free. Because we know that tobacco product use, and there's evidence to support this from a number of sources, contributes to stress, poor emotional well-being, anxiety, depression, substance use, poor mental health outcomes, isolation and lack of social support. One could really argue that all of these outcomes, which have been worsened under COVID-19, which have been worsened by many individuals amidst the movement for racial justice in our nation, tobacco product use also worsens these same outcomes. So by becoming tobacco free, this is also a form of self-care at a time when self-care is greatly needed to get us through the difficulties we're experiencing as individuals, communities, and as a nation overall. I also want to make sure that we see tobacco use in a very clear light. This is not a habit. tobacco product use and tobacco use disorder, the clinical diagnosis for nicotine addiction, is a substance use disorder. It's the most common substance use disorder in our nation, and it's also a chronic disease, very similar to alcohol use disorder, or diabetes, or high blood pressure, or asthma. I say this not to get too sciencey in our conversation, but to really make sure that we all kick this word to the curb of habit. Habit is something far different than a substance use disorder. Tolerance, withdrawal, all of these hallmarks of addiction that are found in other illicit substances are also found in tobacco product use. So essentially, tobacco products produce tobacco use disorder, and it really is manifested in these two pillars. This is what really drives this addiction. It's a physical addiction because it's engineered by the delivery discovered and perfected by the tobacco industry to speed to your brain in a matter of seconds. It's physically addictive, more so than even alcohol, heroin, and cocaine, according to some. And it's also psychologically addictive. So over years and years of use, tobacco product use becomes linked to moods, persons, places, things. And that behavioral recovery is also a significant part of the addiction, and a significant part of the addiction that we try to address concurrently together, with that physical addiction to give people the best chance of experiencing tobacco-free lives. There are ample resources out there for anyone listening in, and we're very fortunate in Pennsylvania to have the wealth of resources that we do. So this is a one-pager here that the health department has compiled that is a list of everything from 12-step support to online assistance, web-based apps, telephonic quit lines that can help someone initiate that recovery process and are free or very, very low cost and accessible and available to any Philadelphian or Pennsylvanian listening in tonight. Just to give you a little bit more about the quit line, and this varies. Some states don't have nearly this range of services that we have. So it's available nearly 24 hours a day. They provide up to 8 weeks, 2 months of free nicotine patches, gum, and lozenges that they mail right to your house. There's a trained coach on the other end who can walk you through the recovery process. They have text messaging available as well. It's a very well-resourced quit line that we have in Pennsylvania. And the science is very clear on this, that folks who use the quit line as a way to quit smoking have greater rates of recovery from their tobacco use. We also are very fortunate, and we know that this is threatened. There are different parties who are trying to rip apart the Affordable Care Act. So at the moment, due to the ACA, we have great coverage with private and public insurance as well to begin your recovery from tobacco product use. So sometimes your greatest resource is also in your wallet or in your pocketbook with your insurance card as well, which was not the case some years ago. So we're very fortunate that through the ACA, coverage for tobacco treatment has greatly improved. And these are all the medications here, you guys. There are 7 that are approved by the FDA to help people to quit tobacco. And notice that e-cigarettes are not included here because e-cigarettes are not approved by the FDA to help people quit smoking. So despite many of the marketing messages that we may have received about e-cigarettes, there is not a single e-cigarette that's approved by the FDA to help people quit smoking. These medications here are generally well covered by insurance. Many of them are over the counter, and they've been well studied to be more safe and effective to treat the physical addiction to nicotine. And they're more effective when you combine them together. So you may be listening and saying, Ryan, I tried the patch in '98, didn't make a dent in my tobacco use. What you may benefit from is combining different medications together, which has been shown to increase your recovery rates from tobacco. And resources like the quit line that I mentioned earlier can help you better find the combinations that would work best for you for your particular tobacco use history. So my final messages for you today, and to honor the time of my talented panelists that are also here waiting to share some very, very important information with you as well, is if you're listening to this and on some level this is speaking to you, that addressing my tobacco product use is something I've been thinking a lot about, but I'm just curious about how to get started. This is what I tell my patients. They're sitting, well, when they did sit across from me when I was in the clinic and not talking to them over a computer or phone. So if you're ready to get started, the first thing I recommend is you set a recovery start date. Have a date that preferably is within the next 2 to 4 weeks, is what I tell most folks. And this is a date you may feel positive about, you feel is realistic, and it's a date that will be supported and backed up by this whole plan that I'm about to walk through with you here as I conclude. But without a date, this tends to be more difficult for people to get started. Many folks here may have said, yeah, as soon as there's $7 a pack, I'm done. As soon as I move into this new apartment, I'm done, or I start in this new job, I'm done. But having a date gives us a beacon on the horizon that we're heading towards. Getting support, that's the T, and telling others. Could be from your family, friends, coworkers, or resources like the Quit Line. Plain and simple, the more support people have, the more people that are in your corner, love you, care about you, are supportive and encouraging, the greater your rates of recovery are going to be. Develop coping skills for your triggers. We're still going to get stressed. We're still going to be bored sometimes. But what do we do different that's a healthy, productive coping skill in those situations rather than a harmful, unproductive coping skill? So knowing that life is going to happen whether we use tobacco or not, but how do we encounter those situations in a way that doesn't involve another alternative besides tobacco product use? And my last 2 points are removing any remainders or reminders. If you have ashtrays, lighters, packs, empty packs, what have you, in your workplace, vehicle, or home, get rid of them. Out of sight, out of mind. And then lastly, talk with your healthcare provider about possible medication options. Chances are, I've seen so many patients over the years where this has been the case, there's always a stone left unturned. There's always a medication that we haven't tried or an approach that we haven't integrated, that when you do so, all of a sudden that can be the cup spilleth over moment to help someone break free of tobacco product use once and for all. So there is always, again, I do not believe that people are incapable of becoming tobacco free. There's different journeys to the same destination. These are my last 2 messages for you here. I think it's a matter of perspective on how you look at your recovery from tobacco. Some of you look at this and see a duck, others may see a rabbit. Both of you are right in your own regard, right? So if I really want to leave you with a few philosophical points to think about if this information is resonating again with you on some level for yourself or people you love or care about. This is not about what you're giving up, it's about what you're getting back. Think of it not as depriving myself, denying myself of tobacco product use, rather than I'm restoring time, health, and money that is mine as a result of being tobacco free. So again, not what we're giving up, but what we're getting back. It's like ending a bad relationship. You can have feelings for someone, love them deeply, care about them to the moon and back, but know that if I stay with them, I'm going to be miserable. The same is true for tobacco product use. So people can feel scared, anxious, fearful of being tobacco free. But still know that this is only going to lead to 2 places for me, hospital bed or a grave. And neither of those are places I want to be. So think of it much more like ending a bad relationship and restoring yourself to yourself. That no matter what we see tobacco product use as, like a stress reliever, a way to socialize, it's more the problem than the solution. Studies show that it worsens stress, it doesn't better stress. And then lastly, whatever your reason is, it could be the smell, not concerns about lung cancer. It could be, I'm tired of being on the periphery of a social gathering rather than amidst a social gathering. Whatever your reason is, it's the right one. And there are no lost causes or hopeless cases. I personally work with people that were 5 packs a day. And if they can do it, you can do it. No one here was born using tobacco. It's all something we've learned and something that we can relearn. This is a quote that I'll leave you with as we talk about the next portion. And it really, I think, rings more and more true to me in the times we're living in. When we talk about tobacco product use, as well as the other issues that are, as I mentioned, are compounded by and worsened by tobacco product use. And it's from a former director of the World Health Organization, which, as we know, has come under a lot of scrutiny recently. But they say, if we do not act decisively, 100 years from now, our grandchildren and their children will look back and seriously question how people claiming to be committed to public health and social justice allowed the tobacco epidemic to unfold unchecked. And I found those words just really speaking to me. Even though it's an older quote, I think it especially has a lot of relevant tie-ins to the times we're living in now. And with that, I just thank you so much for your attention and your time, and really excited for you to be able to hear the great information that Adrian and Lee will be sharing, and for the discussion that will result after those presentations. Here's my contact information if we can be helpful. We try to be accessible and available at the Department of Public Health here in Philadelphia for you, the citizens of the city that we're here to serve. So thanks so much for your time, and very grateful and humbly excited to be here. Thank you.
Sorry. Thank you so much, Ryan. If anyone has questions for Ryan, remember to put those in the chat and we will address all the questions at the end during the Q&A. Our next panelist is Adrian. Thank you for your work with Bradbury-Sullivan LGBT Community Center. Can you introduce yourself and share a bit about the work you've done to promote tobacco-free pride in the Lehigh Valley?
Yeah, and thank you, Celena. And also thank you just to Ryan and Elisa, because Ryan and Elisa are amazing advocates for healthy Philadelphia. And they do tremendous work to ensure that that work is LGBT inclusive and affirming. And around the state, other public health leaders see that and really notice it. So I just wanted to name that for some of your coworkers, Celena, at the Philadelphia Department of Public Health. So I'm Adrian Shanker. I use he, him, his pronouns, and I'm the executive director of Bradbury-Sullivan LGBT Community Center. We're located in Allentown, Pennsylvania, and we provide arts, health, youth, and pride programs in the Lehigh Valley, as well as leadership around public health advocacy around Pennsylvania. We do work statewide to promote tobacco-free living in the LGBT community, and that includes that we administer Pennsylvania's biannual LGBT health needs assessment, which is the most comprehensive data set in any US state measuring LGBT health disparities comprehensively in our community. We then use those data to try to improve public health through behavioral change within our community, structural or policy change with the government and with insurance companies, and clinical changes with providers, with healthcare providers. Some of our work also includes, we filed 3 lawsuits against the Trump administration, 2 of which were focused on, trying to block, actually successfully blocking 2 of his really ridiculous and unconstitutional rules that would harm LGBTQ people's healthcare, including most recently this June, when we filed the lawsuit to stop the removal of non-discrimination protections in the Affordable Care Act. I just have to share that we just sued last week to block the Trump administration's ban on diversity training, because we just know that it's ridiculous to not be able to talk about structural racism, as like a banned word. So, we know that all of these things are critical and they also intersect for our community. So our work is in the Lehigh Valley, but we also do some work statewide, and we partner with LGBT centers and pride festivals around Pennsylvania to empower them. We actually share some of our state grant money with them to empower them to also be advocates for smoke-free communities, LGBT communities.
Great, thank you for sharing. And thank you for being here, and I appreciate the work that you do. I understand that you have a presentation for us as well.
I do, and it's going to be a little bit less formal. I don't have a screen share, but
okay.
I have some things that I think might be helpful. So I'm assuming that folks that are listening in are maybe fitting into one of a couple categories. So maybe community advocates / activists for either health equity or public health, or for LGBTQ plus equity and inclusion in some broad way, or maybe you're involved with one of the LGBTQ plus organizations in Philadelphia, maybe even a pride organization, or perhaps you work in public health or tobacco control. So from any of those perspectives, what I'm hoping to get across are kind of, what does a smoke-free pride look like? How common is it? And how can you do it too? So first, I'll just share, Ryan shared such really useful information, and I did put in the chat just about the quit line, that all the quit line operators have been trained regularly on LGBTQ plus inclusion, equity, cultural awareness, and also the quit line data includes sexual orientation, gender identity data. It's one of the most comprehensive data sets in the state measuring LGBT health. So, but when we're looking at, Ryan talked a little bit about wellness, and he shared 8 ways of thinking about wellness. I want to share one way of thinking about wellness, which is a definition of wellness from a 14-year-old youth program participant at Whitman Walker Health in Washington, D.C. And this wise 14-year-old said that wellness is about surviving in a world that wasn't made for you. surviving in a world that wasn't made for you. And as all of you who have ever worked to support LGBTQ plus youth know, that that's what our youth population does every day, right? We struggle to survive in a world that wasn't made for us. And even LGBTQ plus adults, that's the world that we're in. We're in a world that wasn't created for us. So wellness is the struggle to get there. Health equity is the dream, and it's a dream that's not yet realized. It's a dream that the US government defines as the attainment of the highest quality of health for all people, not for white people, not for men, not for cis people, not for straight people, not for US citizens, for all people. So all people deserve health equity. It's actually something that we can expect. It should be an expectation, but it's a dream that's not yet realized. And one of the reasons it's not yet realized is because of the pervasive disparities. When I say disparities, I mean the difference between the majority population and the queer population. So when it comes to tobacco in Pennsylvania, our local data in Pennsylvania shows that the smoking rate is more than double for LGBTQ plus people, almost triple for trans people, and for LGBTQ plus people of color, almost triple that of the majority population. When we look at LGBTQ plus youth, it's almost triple the majority population. So parts of our community experience even more harmful disparities than the LGBT community as a whole, and the LGBT community as a whole experiences significant disparities from the majority population. And this isn't because of anything biologic about queer people. This is because of the social conditions of our lives, right? We survive through family rejection. We survive through pervasive community violence and school bullying and workplace discrimination. And all of these social factors lead queer people to turn to coping mechanisms. But unfortunately, tobacco is a coping mechanism, but it's not one of the coping mechanisms that leads us on a path to a healthy life. And what's more, the tobacco industry has sought us out. They realize that the social conditions of queer people's lives lead us to seek out coping mechanisms, and they've marketed directly and aggressively to reach our community. In fact, court documents that were revealed from the 90s actually showed that the tobacco industry called the marketing campaign that targeted LGBTQ plus people, they called it Project Scum. Like, no joke, not an exaggeration. That's what the tobacco industry thought of us in the 90s. I don't want to project to what they might think today, but certainly the court documents suggested that that's what they thought of us then. So historically, at the same time, tobacco companies were the primary sponsors of Pride festivals around the country. They were one of the first industries, frankly, that was willing to say anything aligned with LGBTQ communities, because so many corporations were scared of being associated with queer people. Like, shame on those corporations that thought that they couldn't associate, and also, like, shame on the tobacco industry for using it only for capitalist motives. So prides today, overwhelmingly, just like gay bars outside of places like Philadelphia, can be literal smoke-filled rooms. They can literally be places where the air is so thick because it's during the summer, and there's so many smokers in a confined area that it can be actually hard to breathe. So what we've done in Pennsylvania is we started in 2014, and we started with just 3 Pride festivals: Lancaster, Allentown, and Reading. Today, it's 14 Pride festivals that have gone smoke-free. What does this look like? It means that smoke-free Pride means a couple things. First, it means no tobacco sales at Pride, no tobacco industry sponsorship or marketing or vendors at Pride, and no tobacco consumption at Pride. Plus, it means that we have on-site tobacco dependence treatment specialists, like Ryan, for example, at a Pride festival to provide direct cessation services to help somebody quit. In Harrisburg, one Pride Festival attendee said that it's important to promote smoke-free living in Harrisburg because we have a lot to live for. And I think that's totally true. That's what queer people have. We have a lot to live for. We have to, we have relationships to live for. We have community that we build for ourselves to live for. Like, we have a lot to live for, and we're not going to get there if we let tobacco get in the way. I want to just wrap up by saying that, Pride is a celebration. It's also a damn protest. It's a protest because we have not achieved that dream of equity in our world, and because parts of our community continue to be even more harmed than the entire LGBT community. So one of the things we should protest against is the capitalism that leads us to shorter lives, and that's why tobacco is a justice issue, and that's why smoke-free prides needs to be central to the fight for justice and equity for our community. It's a time when we demand justice, and advocating for our health and our bodies should be central to that wonderful annual celebration. To close, I just want to share, I wrote this book that I published in March called Bodies and Barriers, Queer Activists on Health. And I just want to read 2 paragraphs from this book that sums up kind of why this is so important. We want our queer spaces to be places where we all can enjoy. And that requires our gay bars, community centers, and pride festivals to adopt tobacco-free policies. In some places, it's a given. The laws in some communities require all bars or all parks, for example, to be smoke-free, but not so everywhere. Every community that fights for LGBT health can and should consider how we work for our queer spaces to be smoke-free. All of our queer spaces, the gay bar in the alleyway that's always been a smoke-filled room, the outdoor area on the campus of a local LGBT community center, the entire route of the Pride Parade and the annual Pride Festival. In short, our treasured queer spaces should be places where we can live proudly and live longer. And ultimately, that's the dream. LGBTQ people should have the same lifespan as the majority population, and we should enjoy our lives with equity and justice around us. We can only do that when we separate tobacco from our community, when we demand that our community can have our smoke-free spaces too. And I'll put my email in the chat in case there's any follow-up questions as well.
Thank you so much, Adrian. And thank you so much for the work that you do. Thank you for filing those lawsuits. I think we all thank you. If you could put the name of your book in the chat for folks that might be interested in that too. So moving on, folks, unfortunately, I was just informed that Lee was pulled away and had another calling and is unable to join us. So that means we're going to move right on into the Q&A portion of our discussion. So I've been keeping an eye on the chat. I don't think I may have missed some questions. So Allie, Eric, if you see any questions in the chat, if you could point those out to me.
Celena, I don't see any questions yet in the chat, but if folks have them, they should definitely throw them in there.
Well, at this, I think that now, if folks if you have questions, you could just unmute yourself, and just ask questions if you have them. I think that'll be fine. No follow-up questions? Okay. All right, well, thank you.
So Celena, can I just if there aren't questions, I'll just say one other thing.
Yeah, absolutely.
So around Pennsylvania, I mentioned that 14 Pride festivals have gone smoke-free, and I just think it's important to kind of hammer this home for a second. The 14 prides that have gone smoke-free are rural communities where the smoking rates are even higher than in Philadelphia. Mm-hmm. And where people presume that the LGBT community is sometimes kind of backwards, like sometimes not having the activism that's needed in our community or our movement, right? These are rural festivals like Milford, Pennsylvania's Pride Picnic, and rural Pike County is a smoke-free pride. Or Lancaster Pride, you know, in the middle of Lancaster County is a smoke-free pride. York Quality Fest is a smoke-free pride. Certainly our festival in Allentown, Lehigh Valley Pride, Central Pennsylvania's Pride Festival, Reading Pride, Erie Pride, you know, these are all smoke-free events. The alternative pride in Pittsburgh called People's Pride is a smoke-free event. The 2 largest pride festivals in the state, I'm just going to shame them for a minute. So, you know, Philly Pride and Pittsburgh Pride are the two largest festivals in the state. These are not smoke-free events. You know, Close by in New Hope Pride is smoke-free. Chester County Pride is smoke-free. Doylestown Pride is smoke-free. It's important that advocates in Philadelphia speak up to your local Pride organizers. And I say this as a Pride organizer. I produce a Pride festival with my team at Bradbury-Sullivan Center. I know how hard it is to produce a Pride festival, but it's important that community members speak up and demand that a Pride festival is run with the values that the community has, and that one of those values is healthy living and advocacy for long lives. So it's important that you speak up and let the board members of Philly Pride Present know that it's important to Philadelphia queer activists that your local Pride is smoke-free.
Thank you for that, Adrian. I do know that Ryan, Alyssa, and myself, when I was at William Way, we've talked extensively about Philadelphia, our Pride going smoke-free. So yeah, that's something we all hope will happen soon. I do see some comments in the chat. Allie said, as many of us know, Philly Pride is not smoke-free. I would love to hear from Adrian what was needed to make Allentown smoke-free and what lessons we might be able to bring here to Philly.
That's a great question, Allie. I think since I'm the organizer of Lehigh Valley's Pride, I won't use that as an example because it wasn't really hard for me to tell myself to go smoke free. We took over our Pride Festival, and the first thing we did was make sure it was smoke-free. But I can share how it's worked with other Prides. I think Reading Pride's a really good example. So in Reading, the city of Reading, it's a small city in a part of the state that is quite rural and without a lot of resources for the LGBT community. Reading Pride was one of the first to go smoke-free. They were one of our champions. For Reading Pride, we basically offered to provide signage for them to help them with announcements to really support their festival. But we also gave them sponsorship money, and we subcontracted one of our state grants and gave them sponsorship money to help them go smoke-free, because historically tobacco companies have been a sponsor of Pride festivals. So we actually think it's important that we replace these costs and empower Pride organizers to use those funds that we can provide to print the signage throughout their festival. And really, so we want to put the money into our movement, but we also want to make sure that then that money is used to really get the message out to the community. And so that's what we did with Reading. In the first year of Reading being smoke-free festival, they did get some pushback. It was a very vocal minority of people, maybe like 3 or 4 people. They made a lot of noise on social media saying that they would never come to Pride. But Reading Pride had more attendees that year than ever before, the year they went smoke-free. Similarly, Chester County Pride went smoke-free. They actually told us that they had more people, young parents with young children, who came to the festival as a result of it being smoke-free, because many parents with young kids don't want to go to spaces where people will be smoking in a densely populated area. So that's just another example. With Erie Pride, Erie is a good example too, because Erie, there's a very high smoking rate. It's one of the highest smoking rates in the whole state for the general population is in Northwest PA. And so for Erie, going smoke-free was a really big deal. But what it was with Erie was really their Pride organizers just knew it was the right thing to do. And they just put it out to the community. They have had very little pushback. Ultimately, there's been very little pushback. And so what we do is that we take one of our LGBT organizations, either us or someone else, we go to the Pride Festival, we put stickers on people that say LGBT smoke-free, we demonstrate there's community support for it. We don't police smokers, but we do, and we don't have like security guards forcibly remove people, but we gently go up to people and remind them, hey, you might not have seen, but it's a smoke-free event. Would you mind leaving the festival and coming back? What we don't do, we don't under any circumstances allow for a designated smoking area. That's kind of like having a designated peeing area in a swimming pool, which is gross. So it's also gross to be in an area where there's like, it's supposed to be smoke-free, but you can still inhale secondhand smoke. So we don't allow that, but we do encourage people to like leave the festival and come back in. And it really does work in every other place that's tried this.
Okay, thank you. There's another comment from Chris. Adrian mentioned some of the unique patterns of use for certain groups within the community. What do we see as potential solutions to address those tobacco use disparities for each of those groups?
Well, I mean, so first off, let's be really, really abundantly clear. We have to address structural racism if we're going to talk about health disparities. We have to address like systemic sexism in our healthcare system if we're going to talk about health disparities. We have to address transphobia in our communities if we're going to talk about health disparities. So like this is part of the conversation. We know that trans communities, Black and brown communities, LGBTQ plus youth are some of the highest rates of smoking within the LGBT community. Oh, also bi and pan communities as well. So, and what is that? You know, I think it's very clear that we have a disparity for the entire LGBT population. And I don't want to undermine that's very clear. All LGBT people live at higher risk of tobacco use than the majority population. But we know that some parts of our community are hit extra hard. And so A, we need to focus resources where there's greatest social need. And B, we need to address these societal problems, these big picture issues, what I call the social conditions of our lives, or what public health people would call social determinants of health. So we have to talk about it from that big picture perspective. And then we need to look at, okay, who are the messengers, the trusted messengers? So if we're talking about, you know, for example, trans smoking rates, we need to empower some trans community leaders to be the messengers on this. Because like, I'm a cis guy who's white, who lives in Allentown. I'm not a messenger for, you know, for trans smokers in Philadelphia. We need messengers who are trans people living in Philadelphia to be trusted messengers, right? And what does that look like? It means in part that we have to provide training for trusted messengers to be community advocates on this issue, because people can be great leaders, but they need to be trained on how to talk about tobacco, right? Which is not hard to learn. It just means we need to teach. We need to provide some of that opportunity to teach. And then we should look at even providing stipends or other forms of compensation to these advocates to be kind of peer mentors and or trusted messengers, however you want to call it in different organizations. But you know, empowerment plus compensation. And then the third piece is measurement. How are we measuring results? So we need to have some strategies in place and some specific goals in place to address the intra-community disparities, while at the same time, we're talking about all tobacco disparities for the whole LGBT community at the same time. When we're talking about LGBT youth, there's one other piece, which is we have to also talk about family rejection. We can't talk about the LGBT youth smoking disparity and not address the fact that adults still throw children out of their homes when they come out, and that is a huge reason why we have such a high smoking rate among queer and trans youth. So we also have to address the family rejection piece. And the last thing I want to say is that, you know, we can all do better when it comes to addressing systemic racism and sexism in our society. And yet that is not the only issue. We also have to stand up against the capitalist industries that profit off of our tobacco use. And we have to speak about this from a justice-oriented issue and make tobacco cessation a key issue in our social justice movement. That what we're talking about is being a strong advocate for our bodies and our lives. When we reframe that discussion, and we're not just talking about how many smokers quit, but we're talking about how our community has separated an industry that profits from us and kills us away from our movement, then we can win. And so I think it's important that we talk about it from that kind of social justice lens as well. And that is a big diversion from how public health has often spoken.
Great points, Adrian. I think you made some great points, and not only that, they lend to a lot of the things that Ryan spoke about how we look at wellness. So thank you. I think we have one last comment from Bobby in the chat. Bobby says, listening from California and have been to many Pride events. Most of the events are not always smoke-free, but they do offer areas or places for smokers to go smoke. I know as a former smoker myself, it must be hard for smokers to quit and to have them still join the celebration. It is nice that it gives them a place for them to smoke, although it would be nice to be smoke-free. It's going to take some work, but I'm sure we can make it happen. Keep up the good work in Philadelphia.
So I'd like to speak to that because we hear this a lot. It's probably the number one thing that we hear. And Bob, thank you very much for asking that question. So my Pride Programs Manager at Bradbury-Sullivan Center is a smoker. Our festival is smoke-free, but the person that I've hired to produce our festival is a current smoker. And I have members of my staff who are smokers, and we have members of our community who are smokers. Nobody is here to shame smokers. So that needs to be said like abundantly clear. We are not here to shame smokers. Pride organizers are not in the business of shaming smokers. And even like folks like me and Ryan, we're not here to shame smokers. We're here to provide avenues to help people achieve their goals of quitting tobacco when they're ready to do it, right? And you know, I don't want to speak for Ryan, but that's really the goal. We're not here to shame anyone, but creating designated smoking areas isn't the answer, in my opinion. I think that the bigger answer is to say, you know, this event is going to be a smoke-free event entirely, and while you're here, we're asking that you respect that. You know, if you're ready to quit, we have resources for you. If you're not ready to quit, please just respect the space as a smoke-free space. In the same way that when you go to a restaurant in Philadelphia, you know, the entire restaurant is smoke-free. And what that does is it says to all customers that they can go to that restaurant and not have to breathe in secondhand smoke. Or in the cities that have smoke-free parks, when you go to the park, you know that it's a smoke-free park, regardless of if you're a smoker or not. Right now, all casinos in Pennsylvania are temporarily smoke-free. If you go into a casino in Pennsylvania, you know you're not going to smoke. It should not be different for Pride festivals. Our spaces deserve to be smoke-free. For current smokers, you know, we're not going to shame them. If they need to take a smoking break, leave and come back. Like, let's make that possible so that they can re-enter without paying twice to come in again. But like, let's keep our queer spaces sacred and smoke-free. Ryan, do you have other thoughts on that? I was not intending to speak for you.
Actually, Ryan had to jump off, so sorry about that. But thank you. That was important. That was great point. I also agree. I think allowing folks to leave and come back in is the way to go. Good thing. Did anyone else have any more questions? Anything else you'd like to share, Adrian?
Well, I would just invite anyone who's listening in, who lives in, especially in the Philly area, to, you know, it's likely that our next Pride season will be an entirely virtual Pride season across the country. But when it's safe to resume in-person Pride festivals, I invite folks in Philly to come and check out one of our amazing smoke-free Prides. New Hope would be the closest and easiest to get to for folks who don't have private transportation, who live in Philly or Phoenixville. But you know, come and check it out, and you'll see that it still feels like a vibrant queer celebration. It still can feel like a protest. It can still feel like everything that you want out of Pride, without a harmful substance that makes it hard to you know, breathe the air.
Well, thank you so much. Thank you for joining us tonight and for sharing all that information. Thank you once again for the work that you do. I wanted to give folks one last chance to ask Adrian any questions before we let you go. I know that you are you have something else to attend, so I didn't want to hold you. Okay, Rashana, did you want to close us out, or?
So yeah,
It
thank you,
looks like we
everybody.
just have one more question. I'm so sorry,
Okay.
y'all.
Okay.
I'm sorry, Ollie, go ahead.
Dennis asked, I'm curious about how medical marijuana would or wouldn't be included.
Sorry, I was muted. That's a great question. So first off, I want to separate medical marijuana from recreational marijuana because it's hopeful, in my opinion, that by the next in-person Pride season, we have legalized or at least decriminalized, you know, non-medical marijuana in Pennsylvania. marijuana is a social justice issue too, because we shouldn't be incarcerating people for drug possession or drug use. We can talk about healthy living and also destigmatize drug usage at the same time, and certainly decarcerate our community. So we can both fight for an anti-carceral system and also fight for healthy living. So first off, marijuana smoke is still smoke. So smoke-free spaces should still be respected. And we can fight both for the opportunity to have legal marijuana and the ability to have spaces that are free from secondhand smoke. Those are not oppositional, in my opinion. That I'm speaking on my own behalf. There might be people at Philly Department of Public Health who feel differently about this issue, and certainly people at Pennsylvania Department of Health who might feel differently, but this is my perspective. Now, medical marijuana is not able to be smoked. Now, it can be vaped, but right now we're considering also that any smoke is smoke. So most people can consume medical marijuana outside of the hours of the Pride Festival and stay within their medication regimens. And there's also numerous options for medical marijuana that are that don't lead to smoke. So we would consider any smoke, and that includes vapes, and that would include vaping marijuana too. However, we wouldn't tell someone that they can't carry like medical marijuana with them. We did remove one vendor at Lehigh Valley Pride who was selling marijuana, which was not legal. So we had to remove them for that. But we in general, we wouldn't consider medical marijuana, the presence of medical marijuana being a problem unless it was being smoked at a smoke-free event.
Great point. I was going to ask that same question about was vaping not allowed?
Yeah, so vaping is, smoke that comes out of vapes is still smoke too. There's a really significant difference that Elisa might be able to speak to more than I can, because I'm not a tobacco treatment specialist. I'm an activist. So I didn't go through some of the same training that Elisa has. But we don't know all the science behind vape. We don't know all the chemicals that are in some of the electronic nicotine products. And as a result, we don't know how harmful the secondhand smoke is. We know it's harmful, but we don't know just how harmful, because the tobacco companies keep changing the stuff. And so we don't always know what's in it until a lot later. So we'd say it's a smoke-free event. We mean smoking and vaping. And again, we're not like policing people. So we're not going to have like a security guard forcibly remove somebody for taking like a hit from their vape pen. But like we are gently reminding people, and overwhelmingly our community respects the smoke-free space and really honors that. Elisa, did I get anything incorrect about the smoke that comes off of vapes?
No, I think that was totally right, Adrian. And I would just add, there's some preliminary evidence that youth who vape are more likely to contract COVID-19 and also have a more severe illness. So just thinking, broadly about the public health concerns of our times, and how smoking or vaping or really inhaling anything in the lungs can have other kinds of detrimental effects on your health and well-being. So yeah, thanks for that question and comment.
Well, thank you. I do want to read this last comment that is from Alyssa to Adrian. Alyssa says, I hope it's okay that I'm quoting you on Twitter, Adrian. Thanks so much for your thoughts and contributions.
You can tweet away.
Thank you once again. Thank you so much. Thanks everyone for joining us. I guess we are gonna wrap up. I appreciate you once again, Adrian. Thank you, Alyssa, for the work that you do. Thank you, Rashana. Thank you, Eric. Thank you, Allie. And thank you everyone who joined us tonight. Good night. Stay tobacco free.
Thank you. Thanks, Celena, for facilitating.
Good night.
Good night.
Good night.